Hello, good evening, and welcome to another episode of Become a Better Man. My name is Tunde Disu, and today we are having a treat. It's a party time in this place today because today we are looking at another aspect of our health. As you know, for the past this is the fifth week now that we'll be looking at health awareness. In the first week, we looked at health generally and we focused our conversation that day on building a good relationship with your GP, making sure you do your regular checkups, making sure you do your screening and all of that. And the second week, we looked at mental health. The third week, we looked at vision, the eyes, and all of that. And on the fourth week, which was last week, we were looking at nutrition and physical exercise. Well, I thought we were going to end it last week, but hey, we're back on it again today because today we have a special guest. Special guest, somebody really close to my heart, a good brother, a good friend. A dentist is in the house today, so open your mouth wide because the dentist is going to look inside. Today we have a great man who is going to talk us through the issue of dentistry. And before I bring him on, I just want to again repeat the same disclaimer that I mentioned last week. The opinions that are being shared on this platform are personal opinions. They are not medical advice or medical instructions. If you need medical advice, if you need medical direction, if you need medical guidance, please go and see your GP. Please go and see your registered GP. But today we're looking at dentistry. We're looking at what's in your mouth. What is in my mouth? If you notice the banner, the flyer that went out, the topic said, watch your mouth. Watch your mouth. And one of the things that really occurred to me, you would think it's something that one should be aware of. But as I was preparing for this program, it occurred to me that the pathway into our stomach, into our belly, into all the other organs on the inside is mostly through our mouth. And so it is very, very important, the condition of our mouth, the state, the healthy condition of our mouth, and all the elements that are in our mouth, because whatever is on the way will somehow find its way downstairs into our guts. When we talk about dentistry, there is a limited view and understanding that a lot of people have, most of us that we have when it comes to dentistry. Because as far as we're concerned, a dentist is just simply somebody who looks after your teeth and treats your tooth decay, and maybe you have a sore gum and they will inject it and all of that. But added to that is there's always been a dread when it comes to when people talk about dentists and dentistry. It's like, ooh, I don't want to go through the dentist because of this, because of that. And we're going to cover all of that on today's program. But suffice to say that dentistry is a branch of medicine because dentists are medical doctors, except for the fact that they major in looking after the health and the well-being of our mouth and some of our facial features, which we will look at today. So when we talk about dentistry, it's not just an attachment to medical profession. It is a part and parcel of the whole of the medical profession as a whole. It's a branch of medicine that focuses on diagnosing and preventing and treatment of every condition that has to do with disorder in our oral cavity and all the other things that associate with that, like your head, your face, your jaw, your neck, your cheek, your tongue, your saliva glands, and all of that. So dentistry is more than just your teeth and your gum. It goes further than that. It involves, in some cases, reconstructing your jaw or your part of your mouth or your and all of that, your tongue, your salivary gland, and all of that are all covered in this field of dentistry. But as you know, I'm not a doctor. And so at some point, we're going to bring in our guest. But let's look at where we are. You see, the oral cavity, which is our mouth, is not an isolated area of our body. It's part and parcel. In fact, I will go as far as to say it's an important and integral part of our body system. And so the dentistry profession plays a vital role in ensuring the overall health and well-being of each and every one of us. For instance, you'll be amazed that some illnesses in our body, some diseases in our body will be discovered through the examination of our mouth. Things like lumps, things like ulcer, things like discoloration. Most of this will first be identified when they say open your mouth and they look inside, and then they will refer you to the doctor that will treat you. So it's as important as the surgeon. It's as important as the optometrist. It's as important as any other of the medical professions that you can think of. And so when you look at the work they do, when you look at the composition, what is required to be qualified as a dentist, it is equally what is required to become any other specialist in the medical field. Because after getting their first degree, now they will go to the medical school to go and specialize in wherever they specialize, except that in this case, these people will go and become doctors of the mouth. Another thing I found out when I was studying for this program is that apparently, you see, when we say somebody is a dentist, all we think about is the person that will look at your teeth and help you clean it up or drill it or crown it or fill it and all of that. But I found out there are nine areas of specializations when it comes to dentistry. There's the dental public health. There's the, please bear me if I don't pronounce it well, endodontics, the oral and maxillofacial pathology, and another maxillofacial radiology, maxillofacial surgery. There is orthodontics and dentofacial orthopedics. There's pediatric dentistry, periodontics, and prosthodontics. I mean, all these are different areas that people specializes on when it comes to dentistry. But look back at your teeth, and if you examine your teeth, you will recognize that there are 4 different types of teeth if you've taken time to study it, to look at it. And I found out, well, we did this, you will have done this too when you were doing biology, the 4 types of teeth in our mouth. You have the incisor, which is the 2 front ones. Then you have the canines, which is the next one to that. Then you have the premolars, and then the big man at the back called the molar. And each of these 4, they serve different purposes. They do different things. And so it is important for us to take care of all of them, because what the incisor can do, the molar can't do it. What the premolar can do, the incisor can't do it. So it's very important that we take care of that. One of the issues with dentists that I've seen, I've heard, and you probably have seen it too, is that a lot of people are afraid of dentists. Let me ask you, are you one of them? Are you afraid of visiting your dentist? And if you are, what are you afraid of? Why are you afraid of your dentist? I'd like to get some response to that. If you are one of them that are afraid of going to see your dentist, why? Because you are not afraid to go and see your GP or to go and see your consultant in the hospital who's going to look at your liver, your kidney, your dermatologist, and all of them. So why are you afraid of the dentist? And so I was looking at why are people afraid of dentists, and you'll be amazed there are loads and loads of reasons why people are afraid of dentists. 1 in 5 people, count 1, 2, 3, the 5th person that you know, that you see, that you can point to right now, is afraid of going to see the dentist. But why? One of the reasons why people are afraid of dentists is because if your parents, for instance, are afraid of dentists, they tend to pass that fear to you. They, not directly, but indirectly, because they say it, that they are scared of going to the dentist. As children, we tend to trust our parents, and we should do. So when your parents are saying, oh, I'm dreading going to sit down in the dentist chair, I don't want the dentist to drill my teeth, you can literally imagine what that was or what that meant. And so that fear is transported to you. Another reason why a lot of people are afraid of dentists is because they have a bad experience when they were children or when they were in primary school, and the school dentist just want to fill the blank spaces and said, I've done it, I've been there, and so they in some cases were not giving it good attention, proper care when they're looking at children's teeth. So that fear that was birthed when you were in school tend to carry on as you go along. Another reason why people are afraid of dentists is because, let's face it, it's a natural thing, because our mouth is a vulnerable part of our body. Really, anything that goes into our mouth is because we want it to go into our mouth, unless there's something else. Anything that passes through your lips into your oral cavity is because you want it to be there. It's because you put it there. It's because you allow it to be there. But when you go to the dentist and the dentist says, open your mouth wide, and because you can't even see what he's seeing, you can't see what he's doing, all you hear is the sound of the drill and the knocking of your teeth, it is natural for you to feel, what is going on there that I don't know about? What is this guy doing with my mouth? Added to the fact that our mouth is naturally an air passage. And so anything that tends to, that may obstruct that flow of air into our system, it's not very comfortable. Again, unless something that we deliberately, by our own decision, decide to put in our mouth. Another reason why people are afraid of dentists is because they've experienced pain. They've sat there and somebody has really messed up their mouth and they've lived with the pain for a long time. So because of that one experience, they're like, I'm not going near that guy again. Those guys, all they know is to inflict pain on you. One funny reason I found that people are afraid of going to the dentist is because some people just like to be in control. They like to be in charge. They like to call the shot and all of that. And so that idea of sitting in a dentist's chair where you are reclined all the way almost horizontal and you don't know what's going on, they feel that they are losing that ability to be in charge. So in order to avoid losing the ability of being in charge of themselves and the situations around them, they're like, I'm not going near that guy. Another reason people are afraid of dentists is because of people are just generally, most people are afraid of the syringe. It's bad enough the syringe going into your body. It's bad enough syringe going into your backside. It's bad enough in your arm. But when it's going in your mouth, Jesus help us. And so people are generally very cringy when it comes to somebody poking your mouth with a sharp needle and doing all sorts of things. So because people are naturally afraid of syringe, they don't want it anywhere near their mouth. But most importantly, the biggest reason why people are afraid of the dentist is because of the sound of the drill. I know how that sounds. You don't just hear it while they're doing it. Even after they finish, you're still hearing it. It's like there's a motorbike in your head going zzz. And so that fear of the drill, and because we have associated drill with boring hole and breaking things down, it is natural for people to be afraid when it comes to drilling their mouth. I think our doctor is having problem. Sorry, bear with me. Oh, there you are. I'm going to bring our doctor now. Oh, come on. We don't want to do this again this week. We need this to work, please. Just bear with me, please, guys. Right, I've invited him. Have you seen the invite? So, if we have this fear of going to the dentist, the question is there a way to overcome the fear? Are there things that we can do to overcome the fear that we have? Oh, come on. Sorry, guys. There are ways, there are things you and I can do to overcome the fear. There are things that we can actually do because in most cases, we are in control even though we don't know it, or we are not sure whether we are in control. Again, because of the issue of this fear that people have, they tend to feel they can't talk to their doctors. People tend to think, oh, you can't ask the doctor any question. Oh, come on. They think they can't ask anything, they are afraid to ask. But let me tell you, one of the most friendly people you can meet are doctors. Because they recognize that for you to come to them, there must be an issue. For you to even think of coming to them, you have some problem. So they are more open to help. They are more willing to support. They are more willing to assist you. Why is this guy not seeing me? I'm just going to continue. Hopefully he will get it. So, how do you overcome the fear of going to see your dentist? Oh, by the way, I asked a question earlier on. How many of you are afraid of the dentist? And why are you afraid of the dentist? I've not seen anybody respond yet. Are you one of those who are afraid of the dentist? And if so, why? If so, why? Any taker? Nobody yet. All right. One of the ways by which you can overcome the fear of seeing your dentist is, number one, when you make the appointment with your dentist, just tell them that you're afraid. Tell your dentist what you are concerned about, what your fear is, why you are dreading, why you actually didn't want to come for the appointment, why you almost backed out of the appointment. Talk to them. Like I said, doctors generally are trained to have empathy, to sympathize with you, to be open, to be willing, to be committed, to make it good and make you comfortable when you are with them. The same thing with your dentist. So one of the things you can do is to have an open, honest conversation with your dentist to say, to be truthful with you, I didn't want to be here. I really just didn't want to come. But now I'm here. What can we do about it? And in most cases, what they will do is to sit down with you, to talk you through, to explain to you, to encourage you, to advise you, to guide you through what you need to do. This guy. 1 minute, guys. I'm sorry about this. Have you not seen the invite? I've sent it twice now. Lalo? Okay. But you are my friend on Facebook because I'm trying to invite you, but it's no. Let me see. Wait. Yeah, I can see you're watching, but when I then try to add you, it's not. You say you're not seeing the invite. That's the challenge. Yeah, I've sent it again now. Try and see what you can do. I can't keep people waiting. So join us when you're able to connect. Sorry about that. So first thing is to talk to your dentist and explain the situation. And let them know that these are your concerns, this is what you're worried about, and they will do whatever they can to make you comfortable. Another thing you can do to help you when you have this issue with your dentist is go with a friend. Take a friend with you, somebody that you know will support you, somebody that will help you, hold your hand, tell you what is going on, help you through talk you through what the dentist is doing. Since you can't see because you're already looking into the ceiling, your friend will be able to tell you everything is fine, don't worry, he's doing good, he's doing fine. And that moral support will help you through that season or that session with your dentist. Another thing you can do if you are afraid of your dentist is if you're not comfortable with the chair being reclined almost flat, where if it feels as if you're laying flat on your back, if that's uncomfortable, another thing you can do is to ask if you can sit up. that you're not comfortable lying flat like that, you would rather sit in a more upright position. It won't be comfortable because it's almost against the way they work. But the truth is, they will do whatever is required to accommodate your concern. They will be there, they will support you, they will work with you. Another thing you can do, especially if you are one of those who are not afraid of being injected or the syringe, once you have the first injection, the anesthetics is in your gum, when that is wearing out, because remember, the teeth is one of the most painful part of our body because it is almost directly connected to our to the nervous system. The root goes deep, so deep you can virtually feel it all over your body when your teeth is being knocked or is being pulled or is being pulled out. So another thing you can say is, look, I think the anesthetics is wearing out. Can I have another shot? Because what that will do is it will numb that part of your mouth while the procedure is going on. That's another thing you can do. Another thing you can do is, again, if you have developed a good constant relationship, constant contact with your dentist, just like we said in the first week about building a good relationship with your medical doctor, with your GP, with whoever you're seeing. If you have established the same rapport with your dentist, you won't have problem because now you've come to trust him. Now he or she knows what you want, how you like your mouth to be looked at, rather than just walking off the street or going to see them once in, I don't know how many years before you go and see your dentist. Let me try this thing again, please, guys. This is just... Whew. Wow. Is this not responding? Sorry, please. Just close the Facebook and reopen it again. Yeah. All right. Where was I? Sorry about this. It's been said that 1 in 3 men, especially men, again, we're coming back to the issue of the relationship between man and their medical, professionals. Women are more willing, are more ready, more committed, and they are more reliable when it comes to keeping their appointment with their dentist. But not men. I I don't understand those men, seriously. I don't know why we don't have a good relationship with the medical people until the teeth is virtually falling out, until the teeth is virtually being swallowed with your spoon of rice before we go forward to see our dentist. But the question is why? Why are men generally afraid of working with medical professionals? Maybe somebody on the program tonight can help me or help us to understand that. Why are men more reluctant to go and see their GP, their surgeon, their dentist, the opticians, whatever it is? What is the cause of this reluctance, for lack of better terms? What's the cause of this reluctance with men? Why we don't want to see our medical practitioners? One of the things I also found out when I was preparing for this program was this issue with, which I found very strange. Apparently, there's something called oral cancer, having cancer in the mouth. It freaked me out. That somebody can have cancer in the mouth. But you see, a regular checkup with your dentist, like we said earlier on, that some of these diseases will be picked up just in the course of your regular visit to in this case your dentist. Some of them will have been picked up early enough, like we said in the first week with the issue of cancer. Early picking it up early, seeing the sign of it, or catching it early gives you about 30 to 40% of survival. 30 to 40% of survival if it is caught early, if it's diagnosed early. It then will be treated early then before it spreads. But again, when it comes to oral cancer, when people don't go for their dental checkup, especially people who are prone to smoking, people who are prone to tobacco, people who like their alcohol. Obviously, I'm not here to legislate for what you do in your private life, but some of these things, they contribute to what happens in your mouth. And like I was saying this afternoon during the promo video that I put up, that this mouth is a pathway into our tummy, is a pathway into everything else on the inside. So imagine if the pathway is not right. Like our guest last week was saying about when fat starts building up in your blood vessels and in other places, it narrows the wall of where the blood will flow through. It's the same thing. If you have decay in your teeth and it's not being treated, gradually what tends to happen is it eats up the enamel of your teeth, will start to be virtually just being eaten up by the decay. And before you know it, your gum is affected, because it will not just stay on the top. It's going to start going down the root to find where the root is, because the only purpose of it is to get that tooth out. And that's when you start having pain. That's when you can't chew. That's when any physical touch in that area becomes an issue, because it's not been taken care of early enough. I can't stress enough, ladies and gentlemen, the importance of where we are, of what we need to do, of how to look after ourselves medically. It is so vital. As you can see, throughout this period, we've looked at different aspects. But those that are particularly related to us, like we've talked about vision, we've talked about your diet and physical exercise, and today we're talking about the issue to do with our teeth. All these aspects of our self, of our body, they are vital, they are important, and if we don't pay attention to them, we pay the price. We pay the price. You pay now or you pay later, whichever way you will pay. The only challenge is, if you have to pay later, it is more expensive. You may have to lose 2 of your molar and 1 of your premolar or whatever. I'm sorry that we can't get this guy on, because there are so much we have talked about that we're going to share on this program today. And now he's done a wall on us. Oh boy. Can somebody advise us on how to get him on? Because I can see him, he's passing comment, but he's not seeing the invite I'm sending to bring him on screen. There are various, while we're waiting for him, I will just continue with my note. Thank God I've already prepared my note anyway. There are various mouth diseases that, yeah. Yeah, just accept that. That's all it is. Just 1 minute. Let me try that again. Yeah, that's what it is. So what do you have on your screen when it says Tunde Disu invites you? What does it say? Can you click on that notice? And you've shut down your Facebook and started again. Oh dear. Because here it's telling me that the message has been sent to you. You've seen the message. Yeah. Do you have your phone? Can you use your phone? Yeah. You have Facebook on your phone. Sorry, sir? Oh. Sorry? Right. While he's trying, let's continue. I know this is like this aspect is like preaching to the converted. I remember growing up, we didn't have a toothbrush and toothpaste. We had the Paco, the stick, and that's what we used at the beginning to clean our teeth and just really scrub it with all the energy that you can muster, and that has, well, I don't know what effect it's had on our teeth, but I know I have a very good set of teeth. I don't have any problem with anything in my mouth. Thank God for that. But for people who are used to, who started with using toothbrush and toothpaste and all of that, as I was preparing for this, I came across this aspect where it says people sometimes don't know how to use the toothbrush. I find that very strange. And as I read further, I understand what they were saying, because even now, when I use my toothbrush, you could virtually see my hand going, my head shaking, and all of that. But apparently, that's not how to use it. You have to be gentle, you have to be easy, you have to not apply too much force. And again, when we started using toothbrush back home, I don't know about you, but when we started, what we used was the hard one. the very firm toothbrush. But apparently that's not even good for your teeth as well. Especially if you're not careful, if that catches your gum, it's going to bleed. So there are so many things that we have that we're doing and not really paying attention to in those days. But looking at it now, it said you use the toothbrush in a circular motion. I'm trying to think how to use toothbrush rather than going sideways and all the corners. But you use it in a circular motion, and you be gentle, you be careful how you rub, especially around your gum line. And also you need to one of the things I've seen with some people is they use the toothbrush and they just splash their mouth with little amount of water and off they go. But apparently you need to rinse that thing, that the fluoride out of your mouth properly. Um, Again, that's an aspect of looking after our mouth, looking after our teeth that probably we have never paid serious attention to. People with arthritis, especially older people, again, when it comes to using the toothbrush, because of the effect of the arthritis on their knuckles and everything, they also have issues. And that is why, as you probably have noticed, electric toothbrush or battery operated or battery powered toothbrush is selling like hotcake now, because everybody just want to put it there and let it do the circular motion and clean what it can clean. Apparently that cleans better than the manual one, but we'll get there. But some of us are used to the manual one. I have some questions here. If only we can get our guest on board. Dr. Lawson Alpha. Oh, I am so sorry about this. This is supposed to work like a dream, but it's working like not a dream right now. Another aspect of dentistry that I also know I've learned about recently is the use of false teeth, denture, where I remember my youngest daughter, where her front teeth was a bit not together in some form or shape. And so we took her to the dentist and they gave her some braces to pull the teeth together. And right now, you wouldn't even know that she ever had that issue. There are so many things these days that the medical world can do to help us in different aspects. But today, as we're talking about the oral cavity to do with her teeth, there are so many things that they can do. I remember then she had to go in and bite into this, I don't know what it is, like a clay or something, so that they can get the proper shape of her teeth and then mold the correction and the denture and everything into that shape. And then she started wearing it. And after some time, right now she doesn't have it. She don't wear braces. You won't even know that she had that issue. I'm saying that to say, irrespective of how long your teeth has been in the condition that it is right now, there is always a solution. There is always a way. There is always something that the medical professionals can do to help you overcome it. So rather than just carry on and suffer in silence, especially again in a country like this where most of our medical treatments are almost free. Take advantage of it and go and see your dentist. They're not as dreadful as we think they are. They're there to help us, and they will help you fix your teeth and get you back online as quickly as possible. I think we're going to have to round it up now because I don't think this is going to work today. I'm so sorry about this. I don't know why. It just hasn't worked today. I have questions here. I will just go through them. Not that I have answers to them. I was thinking we could have our guest on to answer them. But one of the questions that I got here is, at what age should... Oh, yes. I think we got Laolu. Come on. We've got the doctor. He's trying to come in. Oh, thank you, Lord. Doctor, where have you been?
I tell you, I mean, I'm using my phone now.
Okay.
Yeah.
So the issue is with your laptop then?
Well, I've used the laptop, I've used the desktop, and it's basically still the same, but it's working now anyway, so sorry about that.
Well, ladies and gentlemen, this is our guest for today. He is Dr. Olaoluwa Lawson. He's been a medical doctor, especially a dentist, for over 27 years. And like I said in the promo video that I did this afternoon, Dr. Lawson is the proprietor of Precious Smile Mobile Dentistry. And I have known Dr. Lawson now since Noah was a boy, really. We've been together for a long time. He has worked as an associate with different organizations, including Bupa. So I don't want to talk too much. Dr. Lawson, for the time we have left, please, all yours.
All right. Good evening, ladies and gentlemen. Really sorry. I've tried my best, but anyway, we're on now, and I think I should just go straight to the point, as in telling you about about your mouth, really. A lot of people take their mouths for granted, and until something goes wrong, I'm going to give you 7 secrets of a healthy and attractive mouth.
Okay.
Because we're sort of running out of time. So I would like to just give you some points so that you have something to take home with and something that can help. Your mouth is really, really important, and it's the gateway, like Mr. Disu said, to the body. So it's really important that we look after our mouth just like we look after every other part of our bodies. So seven secrets you can hold on to. It's number 1, you have to have a good knowledge of your mouth. Number 2 is you have to know the functions of your mouth. And having said that, if the function of something is not known, then abuse is inevitable. Just like if you buy your car or your laptop, they all come with manuals. So you need to know the functions of your mouth. Also, number 3, you need to be aware of changes in your mouth. Number 4, you need to know what to avoid. Number 5, you need to cultivate a healthy eating habit. Number 6, you need to visit your dentist regularly. And number 7, you need to take care of your mouth the right way. And I'm just going to go through quickly these 7 points. Okay. Number 1, sorry.
Go ahead, sir.
Oh yes, you have to have a good knowledge of your mouth. Your mouth is not just your teeth. Your mouth consists of different parts working together in harmony. Once something goes wrong and there's disharmony, there's a problem. So you have to know, for example, your mouth is made up of your teeth, your lips, your tongue, your gums, your tonsils. It's all part of your mouth. Also in your mouth, as you all know, is saliva, and also present in your mouth too is bacteria. All these work together in harmony so that everything works okay. Now, the second secret, or the second thing you need to hold on to, is to know the functions of your mouth. Your mouth is not just for eating. Your mouth is for speech. Your mouth is for showing affection, married couples and all that, kissing and all that. Your mouth is for expressions, and your mouth is, is there to not just for eating, but for other stuff as well. Number three is you need to be aware of changes in your mouth. Now I'm going to divide this into three parts. You can have the good, the bad, and the ugly. Now, it is very possible for you not to have pain in your mouth, and there's a big problem in your mouth. So the fact that you're walking around and you don't have any pain does not necessarily mean there's nothing going on. I mean, something going wrong in your mouth. I do have patients that come in for checkups and they go, "Oh, I've got nothing wrong in my mouth." And by the time you check it, you find out that, there's a lot going on, and it's just like a time bomb waiting for an explosion. So the next thing is the ugly. Every single part of the mouth, something can go wrong with. It can go wrong with your teeth. Problems can have, you can have problems with your gums. You can have problems with your tongues. You can have problems with your tonsils, your palate, and lips, and all that. So things can go wrong in the mouth. And then, like Mr. Diesel mentioned, the ugly. The ugly part is people do have cancer of the mouth. I've seen so many cases, especially when I go out to visit, people in their homes, and they just complain of toothache, and you get there and you go, "Oh my God, this needs to be referred straight away to the hospital." It is very possible to have cancer of the mouth, and that's one of the very reasons why you need to visit your dentist regularly, so that this can be nipped in the bud. Just before I go on, if you do notice anything that does not, that looks abnormal in your mouth, or like an ulcer that does not heal for 2-3 weeks, you need to get to your dentist as soon as possible, because it could be cancer, especially for people that do smoke. All right, I'm going to move to point number 4 now, that you need to know what to avoid. Number 1, I'm going to point out that you need to avoid tobacco products if you smoke. This is one of the major causes of cancer of the mouth, especially people that chew betel quid. A lot of people from the East chew a lot of betel quid and tobacco together. This is very dangerous, and it's been proven, to cause cancer of the mouth. Second thing you need to avoid is sugar. Too much sugar in the mouth is detrimental to your teeth. And what happens is, the process is that we all have bacteria in the mouth. Bacteria feeds on sugar. Now, if you have constant sugar in your mouth from fruit juice drinks, and sweets and all that, it means you're regularly and constantly providing bacteria in your mouth with food. And once they feed and they're happy in your mouth, feeding on all this sugar, they produce byproducts, which is acid. Acid attacks your enamel and damages your enamel, and that's what causes holes or cavities. And if not checked, it keeps spreading, gets close to the nerve, and can lead to pain, toothache. All right. Another thing you need to avoid, a lot of people brush overzealously, which means you apply too much pressure when brushing your teeth. Now, this is very dangerous, because what you're doing is that it doesn't matter whether you're using a hard brush, medium strength or toothbrush. If the pressure is too much, you will wear down your enamel, and that would lead to sensitivity and can lead to a lot of problems. Now, there are toothbrushes, electric toothbrushes with sensors, where if you apply too much pressure, it flashes or it gives a buzz, and you can be aware that, oh, you're brushing too hard. Okay. Other things you need to avoid is like fizzy drinks. Now, too much of fizzy drinks will erode your enamel, especially for people that enjoying their fizzy drinks, keeping it in their mouth and all that. That will damage your enamel, and it's quite dangerous. If you're going to drink fizzy drinks, you can use a straw, which goes straight into your throat and does not affect your enamel. Even biting into apples, biting into fruits and all that, you need to be very careful, because if this is done regularly, it would erode your enamel. Okay, so the 5th thing we're going to look into is you need to cultivate a healthy eating habit. Now, I don't need to go too much into this, because I'm sure a lot of people are aware that a lot of diets, and I must point out that I do see a lot of Africans chewing, hard stuff like bone and all that. You enjoy your bone, and I do as well, but this can damage your teeth. Also, a lot of people, open canned drinks and all that with their teeth. I mean, it's it should be avoided, because your teeth are very precious. You need to look after them, and we need to avoid that. Also, number 6 is you need to visit your dentist regularly. You need to have a dentist that has integrity. That means a dentist that is sincere with you, a dentist. I mean, most dentists, because when we graduated, we did a Hippocratic oath, which is basically to make sure the first thing is to look after our patients with integrity. And in the UK, I mean, most dentists, the dentistry is highly regulated. So a lot of dentists you go to, we are regulated by the General Dental Council, and we're regulated by the CQC. So most dentists will not try anything, but you still need to make sure your dentist is honest with you. That means if you have a cavity, you have a cavity, they're honest with you, because there was a time in dentistry when, it was, I won't even go into that anyway, so I'll leave that. But you need to make sure you visit your dentist regularly. And the reason for this is that problems in your mouth can be nipped in the bud. If there's an ulcer that looks funny, your dentist can have a look at it, refer you if necessary. If your children need orthodontic treatment, it can be picked up early, and it can be referred to the orthodontist. You can have a tooth that is dead in your mouth that is not giving any problem at the moment. That can be picked up. X-rays can be taken, and a lot can be seen in your mouth that can be brought to your attention, and avoiding problems in future. And also the last point, which is number 7, is that you need to take care of your mouth the right way, which means you can be doing, honest job of brushing your teeth and all that, but it's not the right way. Apart from dentists, we do have hygienists. Hygienists are they're qualified specialists that they look after your teeth, they clean your teeth and all that. And I would recommend that you see your hygienist, even if it's just once a year, because they take the time to specially clean all your tartar, clean under the gums and all that. And if there's any problem, they also show you how to brush. Do not assume you know how to brush. You need to be taught how to be brushed. And you need to tell your dentist or your hygienist, now hang on a minute, could you show me how to brush? And I'm sure they will be very happy to do that. I do that for all my patients. I don't assume, because our vision in our practice in Precious Smile is to make people smile as long as possible for life. You can keep your teeth for life. You can have a healthy and attractive mouth for life. But you need to know how to look after them properly without assuming. You need to know how to brush. You need to know how to floss. You need to know how to use the interdental brushes. And it's so important. We can't do that now, but a pointer is that ask your dentist to show you how to brush properly. Also, you have different kinds of toothbrushes. You have the electric toothbrush. You have the manual toothbrushes. Now, if you know how to use a manual toothbrush, it's equally as effective. But electric toothbrushes are very, very, because they do the job for you, but you need to know how to use the electric toothbrush. I would recommend an electric toothbrush with a small round head, because it fits into your gums, the shape of your gums. If you realize it goes like that, it fits into it, and I've seen tremendous, fantastic results with people using that. And basically, so that's it really. Yes, Mr. Disu?
Thank you, Dr. Lawson. I know our time is fast spent, but before we go, we're going to go through some of the questions that I have here, which are more of general questions so that I can help people really. The first one is, at what age should my child see a dentist?
Thank you very much for that question. You need to start taking your children to the dentist once they start having their teeth, as young as even 6 months, once they die. And the reason is not necessarily for the dentist to look after their teeth or to do anything about that. Is to get your child into is to make your child aware of the fact that they need to come to the dentist and get them used to the environment. Because while they're still young, they get scared of the dental office or the dental practice. So by bringing them with you, they see you going through the checkup, the procedure, and all that, and they get comfortable with that procedure, so that it's like you're developing what's it called, a system in them where they can, once they've grown up and all that, they can continue. It is very important to bring them as early as they start having teeth.
Okay. Still on that on that particular one, what about people who are not used to, say up to now, somebody is, I don't know, you have a child who is 7, 8 years old, and because the parents are not used to the practice of visiting the dentist, and now the child is been to school and the school dentist said you need to go and see a dentist and all of that, what's the advice of how the parents could guide that child, apart from the fact that it's a requirement or a recommendation from the school nurse or the school dentist? How do you walk the child through that process of meeting the dentist for the first time?
Thank you. What most parents do is to get the child ready to come and visit the dentist. And what most parents do is to go through their books. I mean, cartoon books that they show the child, that they read to the child before coming to the dentist. Like cartoons like Peppa Pig that they can
Yeah.
watch. They can tell them, oh, this is the dentist. The dentist is just going to count your teeth if you don't go to the dentist, and you know how to brush and all that. So a lot of parents do actually prepare their child by reading books to them, telling them when you get to the dentist, you have to open your mouth really wide and tell them and make them realize that it's actually a pleasant experience and it's not, something that they should be scared of. So the best thing to really to do is to talk to your child, read books to them, go through some cartoons with them, and a lot of children actually are fine with that.
Okay. Second question. What procedures can I take to improve the strength of my teeth? What can I
Well,
do to improve the strength of my teeth?
okay, well, thank you. The strength of your teeth it's usually increased by fluoride. The toothpaste contains most toothpaste contains fluoride, and what the fluoride does is when you use it, that's why it's advised that when you brush your teeth, you're not actually meant to be rinsing out immediately.
Oh,
You're meant
I was
you're
saying the
meant
other. I was saying it
Yeah,
the other way.
no, you're not meant to rinse out immediately. You're meant to actually brush, spit out, and leave the toothpaste because that allows the fluoride on the toothpaste to be in contact with on your teeth for a longer period of time. So fluoride in the toothpaste. That's why in some parts water is also fluoridated. Some drinks are fluoridated, and that helps in protecting in making your teeth stronger. And also,
Okay.
what you need to do is to make sure you don't damage your teeth by eating things like bone and all that.
What do you have against bones?
I don't have anything against
It's a
bone. It's just
source of calcium, doctor. All right, the next question. Should I consider teeth whitening treatment? Is that something somebody should do?
Absolutely, absolutely. Now, the thing about teeth whitening is it's you need to be very careful. In the UK, in the United Kingdom, teeth whitening is very, very regulated. There was a time when you could go to a beauty technician, you could go, on the internet and all that, and you could, products that are outside the dentist can be very dangerous and you need to be very, very careful. But once you do your whitening with your dentist, tooth whitening products are very, very safe. They come with different percentages. Your dentist will look at the best treatment for you, analyzing your teeth and all that, and they do not damage your teeth. There's a process where they can actually whiten your teeth because whitening your teeth can actually make people look more, well, attractive. And because white teeth is synonymous with youthfulness, and
Okay.
a lot of yes. If you look at children, their teeth are quite white, their baby teeth are white, and
Mm.
the older you get, the darker your teeth will become. Teeth become darker with age, and a lot of people do whitening, but whitening with your dentist is quite safe, and I would recommend that. Yes, it's a procedure that can enhance how people look, which is good. Yes.
Okay. Why are some teeth very sensitive and brittle?
Yes. Some teeth are very sensitive. Number one, sensitivity can be due to so many things. It could be that, well, some people have, they're born with enamels that are very thin. or it could be a defect in the enamel when it's being formed. Funny enough, enamel is being formed in utero, which means it's actually formed when the baby is still in the mother's womb. As a matter
Oh,
of fact, yes, the enamel, as a matter of fact, the adult teeth and all that is actually, that's why when there's a problem during pregnancy, for example, maybe the mother was given tetracycline or things like that, you can actually pick it up when the baby starts or the child starts developing, even the permanent teeth. So the tooth board and all that is actually being formed when the baby is still in developing in the mother's womb. And so yeah, so that's it really.
somebody, one of people watching just posted a question. You were talking about when you brush your teeth, instead of rinsing out the toothpaste immediately, you can leave it for a while. They're now asking for how long can you leave the toothpaste on before you eventually rinse it out?
The thing is, it's up to you, to be honest. There's no hard and fast rule, but the thing about it is you can actually leave it on without rinsing it.
Ew.
It's not a pleasant experience, but what you should do is you can actually, brush your teeth, spit everything out, and just leave it on. And
Okay.
that's it really. That is what is recommended. That you don't actually rinse out.
No, really.
Yes, that you don't actually rinse out. Yes.
See, I told you we're going to learn some things here. Now, the next question. Can poor dental health lead to any serious disease?
Absolutely, absolutely. For example, if you have a cavity which is tooth decay in your mouth, it can lead to an abscess. And an abscess in the mouth can be very, very, very dangerous. You can have spreading abscess that can spread to your neck and can actually kill people.
Wow.
Yes, it can actually kill. It can lead to a condition known as Ludwig's angina, which you have the abscess spreading right into your neck and all that. It's very dangerous. So diseases in the mouth can actually like caries, which seems so simple and all that, can actually lead to devastating conditions like that. Um, you could also have for example, if there is, you can have, but this is very, very uncommon. You can have trench mouth. Trench mouth is acute necrotizing ulcerative gingivitis, which used to occur when people during the wartime. And you can see it in African, some countries that are still backward, where you can have cancrum oris, where the gum is so bad that it actually eats and damages the bone and all that, and it's a massive hole in the mouth, and they have to actually be operated on before something it can get better. So yes, the mouth is so important that you can have a lot of diseases in the mouth. Yes.
Okay. Is there anything that my family doctor needs to know about my denture?
Your family doctor.
Yeah. Is there anything, for instance, I've been to your clinic, you've treated me and all of that. Is there anything I need to then pass on to my GP regarding my visit to your clinic, for instance?
There's nothing you need to pass it to your GP. If
Okay.
you there are conditions in the mouth where if picked up, it might be a pointer to a systemic disease. For example, if somebody comes to the practice and has regular ulcers in the mouth, I would think, okay, have you been to your GP for a blood test? Because having regular ulcers in the mouth, for example, can be a pointer that there's a problem with the blood. There's a deficiency in somewhere in the blood system. And what we do is to refer you back to your GP so that you go for a blood test, and this can be picked up. There's so many conditions also that can be picked up in the mouth, which can be a pointer towards a systemic disease. Even, for example, people can come into the clinic and you can see some lesions in the mouth, and they can point towards HIV. They can point to, a patient might not be aware, and so many things will
In
pick
the
up in the mouth.
mouth.
Yes, there's a lesion called Kaposi sarcoma, which you can pick up in the mouth, and you can go, oh, this looks, very strange. And, tell the patient to see the GP, and they do a test, and so there's so many things in the mouth that you can pick up. You can have dryness of the mouth. If you have dryness of the mouth and patient comes in, you can refer back to the GP. It might be a problem with arthritis, rheumatoid arthritis coming up. So there's so many things we can pick up in the mouth that can be a pointer to a systemic disease. So yes.
Well, before you came on, I was one of the things I talked about was why people are afraid of going to see their dentist. And I've obviously rambled through the things that I've seen, that I've read, and all of that. Your cousin is saying hello to you.
Hello.
From your experience and people visiting your clinic, what are some of the issues that people have in terms of why they're afraid of the dentists?
Well, number one reason why people are afraid of the dentist is because of past bad experiences. It's amazing. Even people in the UK have had experiences when they were children with school dentists, and people, well, I'm not sure, but what a lot of people say is that they've had teeth taken out without local anesthetics, without injections. Yes, I've had so many people say that. So number one reason why a lot of people are scared of the dentist is because of bad experiences when they were young. And that has lived with them, that has stayed with them. And then when they come to the dentist, they have all this experience, they're overwhelmed and all that. And that's the reason, yes.
And
I
so,
seen a patient yesterday that said she went to the dentist and the whole equipment blew up in her mouth and she was really, really, shaking and all that. So that's the reason, yes.
oh dear. Dr. Lawson, before we let you go, talk to us, tell us about Precious Smile.
Well, Precious Smile is the practice which I am the principal of Precious Smile. Precious Smile, the name Precious Smile was coined when I was in school. I graduated in 1992, and when I had the opportunity to get this practice, it's called Precious Smile. It's a practice where our vision is to make people smile for life, help them in having a healthy and attractive mouth. And we major a lot in educating people into how to look after their mouth. I mean, everything is about maintenance, because if you treat them, if you do fillings and all that, and they don't know how to look after their mouth, you're going to go back to square one. Everything is going to break down. So we major in educating people, taking our time on a one-to-one basis to genuinely care and look after people. And that's what Precious Money is all about. And the way we do this is we have, we make sure we use we educate ourselves. We go for courses, myself and my staff go for courses regularly to update ourselves. We use the best materials. We make our environment safe. We make our environment friendly, where every single person is important. That's number one. Everybody that walks into our practice is important, and we look after them accordingly. And even if they come with, horrible mouth and all that, we don't condemn them. It's just that we just give them the knowledge, and people are happy with that. And that's what Precious Smile is all about. Also, we visit the elderly, disabled. We go to a lot of nursing homes. We also operate this mobile service where we can do virtually everything for people that cannot get out of their homes. For example, the elderly, the disabled, people that are agoraphobic, and quite a lot of people. We help them to get their teeth back on, and they're quite happy. And that is what Precious Smile is all about.
Where are you based?
We are based in North Finchley in London, and that's where we operate from. Even though when we do our mobile, we travel everywhere. We go to Oxford, Cambridge, all of Hertfordshire, Bedfordshire, another. But we're based in North Finchley.
So if I'd say after the program, if people feel they want to have a one-on-one with you, is it okay with you if they contact me for me to pass your details to them? Would that be okay?
That's absolutely okay. We're here to look after people. If you have any problems, if you have any concern, you can speak to Mr. Disu, give me a call, and we'll be happy to help.
Good. Well, thank you, Dr. Lawson. We got there
Yeah.
eventually. To all of us, my apologies again for the technical issue we had at the beginning. Well, virtually almost throughout the whole program until we're able to resolve it at the end. Dr. Lawson, thank you. God bless you. We appreciate
Thank you.
you.
Thank you very
Well,
much.
you have it there from the doctor's mouth. We've got to look after our teeth. We've got to we've got to generally look after ourselves. This is the only life we have. We don't have a spare body somewhere that we're going to go back to. This is the only one we have. This is the house where we live. And we owe it to ourselves to take care of it. And part of that, like we've been hearing today, is the issue with our mouth. Everything to do with your mouth, your teeth, your gum, your palate, your saliva, your tongue, and all of that. All of that work together because each of those parts that we've just mentioned, they contribute to helping the digestive system as well, somewhere along the line. It's whether you chew your food or the saliva supply, you have enough saliva to run it down, all of that. Put everything together. We have a responsibility to look after ourselves, especially where our health is concerned. It has been said that health is wealth. And if you doubt that, just ask somebody who is not feeling well. Just remember the last time you had a tiny pain on your fingernail and see how the whole of your body was in discomfort. So it's important for us not to take these things for granted. It's important for us to look after them, do what we have to do, visit our doctors, visit our dentists, our opticians, and again, like we did last week, be mindful of what we eat. Remember, the lady said, if the carbs in your plate is bigger than your fist, you are overeating. God help us. Thank you so much. God bless you. Remember, this platform is here to help us become better men and better women. If nothing else, we owe that to ourselves. If nothing else, we owe that to our family. If nothing else, we owe it to this world that we will not just come and go, and this world will have no knowledge that we were here. But you see, we can only give what we have. And so the better we become in ourselves, the better quality we'll be able to give back into the society, and the better this world will be. I love you, appreciate you. Thank you for staying the course tonight. And we'll meet again next week. And don't forget, if you have not registered for WordFest on the 11th of May, please go to Eventbrite and register. And if you are one of the guests that we have normally on Mondays when we do our practical Bible study on this platform or on my channel, this coming Monday, we're going to have a guest. Sarah Garande is going to be on, and you don't want to miss that. It's a precursor to what is going to happen on the 11th. I can't wait. Thank you for your time. Dr. Lawson, thank you. God bless you. God bless your ministry and your business. We appreciate you, sir. Bye-bye for now.
Thank you. Bye-bye.